Hi, I'm Dr. Ron Klatz with the American Academy of Anti-Aging Medicine. One of the most common questions I've asked by almost everyone is, Dr. Klatz, what do you take for your anti-aging regimen? What do you personally like? What do you think has good science behind it? And so I'm going to show you a few of the many different nutrients that I've tried, and hopefully that will be helpful to you. Aspirin therapy. Aspirin has a lot of science behind it. It's actually approved right now by the FDA for use in the prevention of heart disease. Aspirin will thin the blood. Taking 1/2 of an aspirin every other day is what I do. Some people take 1 aspirin a day. Some people take 1 every other day. I find that 1/2 an aspirin every other day works just fine for me. Magnesium. Magnesium is a very important nutrient that is deficient in most of our diets and is protective with regard to heart disease, and is essential nutrient for hundreds and hundreds of enzymatic chemical equations that go on within the cells and keep us healthy. So magnesium is an important nutrient. This is a 250 milligram tablet. I take 2 to 3 of these a day. But again, the dosage is highly variable and depends on your chemistry and your age and your sex. And you should talk to your doctor before starting any of these things and have him prescribe it for you. But again, I'm just trying to answer that question. What is it that I'm taking that I find helpful or effective, or that the science is strong enough to make a difference with regard to anti-aging? Chlorella is a single-cell organism. It's found in the sea. And chlorella and spirulina are highly detoxifying to the body. They have chlorophyll in them, and they help to clean out the gut. But they also have micronutrients and essential amino-acids. And so they're very helpful for cellular metabolism. And I'll take, about 12 capsules of these every day. There's a great interest right now, great concern actually, on the development of metabolic syndrome and diabetes that occurs in midlife and with aging. And we're finding an old natural remedy seems to have a lot of benefit, and that is cinnamon. Cinnamon goes good in your coffee. It goes good on your breakfast cereals. It goes good in your tea. It also goes good as a capsule. What does cinnamon do? Cinnamon acts as a natural agonist to insulin production and function within the body. So cinnamon helps insulin perform better in your body to help maintain your blood sugar. Now, what happens when your blood sugar is well maintained? We don't get those highs and lows throughout the day, okay? You don't get those swings in your blood sugar, and you may, in fact, slow down the progression of diabetes as you get older, because many of us are on our way to diabetes because of a poor lifestyle, not enough nutrients. Cinnamon is one of those cofactors that helps the insulin molecule do its job better, as does chromium. Now, I don't have chromium here to show you, but chromium is another cofactor you should know about. There's a lot of concern also about prostate problems, and unfortunately, I'm heir to that as well. And so I find that taking green tea extract, EGCG, seems to help with some prostate symptoms for many people. I've noticed that myself, and also that green tea extract is just one of the many cofactors for prostate health. Now, green tea extract can also help improve your metabolism and is being used by some people for weight loss. In my case, I think it's protective against prostate problems, but again, it is helpful. In the news, vitamin D, the sunlight vitamin, the thing that happens when you're out in the sun, is getting a tremendous amount of press. Vitamin D is protective against some forms of cancer. Vitamin D helps metabolism, and vitamin D is the natural vitamin that is produced in your skin from direct exposure to sunlight, hence the name, the sunlight vitamin. So vitamin D3 is something that you should consider supplementing on a daily basis as well. Certainly the science is supportive of that. Well, that's just some of really hundreds and hundreds of nutrients and drugs that are out there right now that should be considered by every physician for anti-aging medicine. The doctors at the American Academy of Anti-Aging Medicine certainly teach this type of medicine. If you'd like to learn more, there are over 100,000 reference scientific papers available at www.worldhealth.net on the internet. That's worldhealth.net. It's a free service of the American Academy of Anti-Aging Medicine.